Surgical site infection. Despite considerable research on best practices and strides in refining surgical techniques, technological advances and environmental improvements in the operating room, that is OR, and the use of prophylactic, preoperative antibiotics, infection at the surgical site remains the second most common adverse event occurring to the hospitalized patients and a major source of morbidity following surgical procedures. There are numerous endogenous and exogenous sources of infection. The patient-related source of infection is endogenous, and processor or procedural-related infection is exogenous source of infection. These two sources of infection affect a patient's risk of developing an SSI, surgical site infection. Some variables, such as age and gender, are obviously not amenable to change or improvement. Fortunately, however, a number of other potential factors such as nutritional status, smoking, proper use of antibiotics, and intraoperative technique can be improved to bolster the likelihood of a positive surgical outcome. Some of the more commonly identified patient risk factors for surgical site infection to be discussed include pre-existing diabetes and or preoperative hyperglycemia, obesity, or malnutrition, pre-existing remote body site infection, recent tobacco use, contaminated or dirty wound, colonization with microorganisms, and perioperative hypothermia. The risk of infection continues even after the patient leaves the hospital. Caregivers should educate the patient and relatives regarding proper incision care, how to recognize signs of SSI, and the importance of reporting symptoms to their surgeons as well as primary care providers. Take-home materials should be easy to read and available in multiple languages. Surgical site infection in Indian scenario. In 2003, CDC reported an estimated incidence of 90,000 deaths per year related to healthcare-associated infections. Average level of patient risk depends upon intrinsic host factors and extrinsic environment factors. Sensitivity and specificity of surveillance programs also a risk of infection. Nosocomial infection sites are urinary tract infection. Most common type of NI, 30 to 40% of reported cases associated with an indwelling urinary catheter or instrumentation. Lower respiratory and surgical wound infection is the next. It is about 15% each. Less frequent include bacteremia, which is about 5%. Intravenous site infection, gastrointestinal tract, and skin infection.